What if adolescent nutrition had a nutrition facts label? Let's see, we're looking at a serving size of over 1.2 billion adolescents across the globe with inadequate donor investments. No wonder why adolescents affected by overweight and obesity has almost doubled, and anemia has increased by almost 20% from 1990 to 2016. If that's how things looked in the past, surely things can look better in the future. Overlooked in the UN Decade of Action on Nutrition, no adolescent-specific targets in SDGs for nutrition, and no clear targets for overweight and obesity in older children or adolescents. Clearly, adolescent nutrition is at a tipping point, and we need to urgently change the label of adolescent nutrition. The key ingredient in the recipe for transforming adolescent nutrition and improving sustainability in food systems is the meaningful participation of adolescents and young people. An important aspect of this is to bring research about adolescence to adolescents. Bridging the gap between adolescence and adolescent research does not need complex calculations that decoding a food label may require. We can think of research translation for adolescents as a simple 6-step recipe. Build connections with adolescents and youth networks. We need to not only hear, but actually listen to what adolescents and young people have to say about their own nutrition, their own health, their own well-being. This can help to ensure that young leaders can further take key messages and act as communicators who inform their local communities and movements about latest evidence and its implications. For example, leaders from youth networks across the world were invited to share their reflections on the key takeaways from Nourishing Our Future, the Lancet series on adolescent nutrition. Regulate. One recommendation from the series I find to be crucial is the urgent need for regulation to restrict advertising and promotion of unhealthy foods on social media. I'm sure you must have already seen an ad for an ultra-processed food brand today on your device or outdoors. New forms of highly engaging and interactive content are exploiting heightened social sensitivity of adolescents. Without regulation and literacy tools, how can we expect adolescents and young people to make healthy decisions while the food industry continues to invest in big budget advertisements? On the flip side, social media can also offer opportunities for positive influences. Some programs are using it as a platform to deliver positive messages, guidance, training, and peer support. Include adolescents in the entire research cycle, including research translation. Not all adolescents have access to a classroom or learning environments. We need to think innovatively about these new ways to reach them, for example, through engaging short videos. Sophie and Mike from Act for Food, Act for Change, Molly from MCRI, and I got together to work on videos for adolescents and young people that move away from jargon and explain the concepts covered in the series. Our engagement as young people ensured that we kept challenging stereotypical depictions of our food and our world. Disseminate research findings through unconventional ways. Research and evidence gets published in the peer-reviewed journals that may reach a bubble of audience, but may not actually reach adolescents. For example, the papers published in the series were converted into adolescent and youth-friendly resources by working with Science Journal for Kids and Teens. These papers were adapted for students, teachers, as well as parents, guardians, and it features free downloadable peer-reviewed research papers rewritten in age-appropriate language. So each paper is accompanied by assessment questions and a feature scheme. So a paper on nutrition and adolescent growth and development was adapted to how does the food you eat affect your growth and development? Food choice in translation, adolescent autonomy, agency in the food environment became what makes you choose the food you eat. Apart from English, these resources are also available in Arabic, Chinese, French, Russian, and Spanish. Governance. National and subnational governments need to ensure young people have easy access to accurate nutrition information through not only simple board front of pack warning labels, but also through promoting healthy diets on social media with messages grounded in an understanding of the drivers of adolescent food choice. Adolescents and young people are involved in all aspects of the food system, from production, agriculture to consumption. Then why, when it comes to governance, can they not be involved in all decision-making levels? Engage each sector. Each sector plays an important role in the recipe of achieving better adolescent nutrition outcomes for current and future generations. The next generation of food advocates need supports from not only those in power today, but also other people in power in different sectors. We can't do this alone. We need all actors that influence food systems, schools, governments, healthcare sector, education ministries, policymakers, researchers, UN agencies, donors to partner with young people at all levels, from planning policy to practice. Achieving safe, sustainable, healthy diets for all adolescents should not be a distant target for 2030 or so on. We need action now for ensuring nutrition for future generations while also protecting our health today. Now, I'm not making false claims that this is just a 2-minute recipe. Research translation for and with adolescents is a long and evolving process. The messages and findings from research need to be tailored and seasoned with local ingredients to contextualize it and make it relevant for adolescents in different regions with different lived experiences. So we need to support meaningful participation of adolescents and young people as the key ingredient in the recipe for transforming adolescent nutrition. We can come together through intergenerational action and transform the label and state of adolescent nutrition.